This is with Dr. Enyinna Nwachuku, and he's the director of Neurotrauma at Cleveland Clinic Akron General. And there's a lot of things to talk about. But first of all, let's talk about what a traumatic brain injury is. And any blow to the head, folks, is important and should be thought of as it being important. But when we talk about traumatic brain injuries, doctor, go down that road and start that for me.
Okay. Well, thank you first and foremost. Thank you, Ray, for having me on. This is a topic that's very near and dear to my heart. So I thank you for the opportunity for us to be able to educate the public on what, the spectrum of traumatic brain injury. So to answer that question, when we think about brain injury, there's a spectrum of severity that we deal with in neurosurgery or even neurotrauma. So the things that most people in the public know about is concussion, or what we call quote unquote mild brain injury. So you bump your head, maybe a baseball bat or something hits you in the head and you lose consciousness for a little bit and come back to. And each of those different scenarios has its own consequences, long-term sequelae. And I think it's important to make awareness of that. So for things more in the lay public that we don't see too often in the hospital is around the realm of concussion, whether it's sports related, whether it's just environmental. People bump their heads, and the things that linger most in folks with that is headaches, concentration issue, nausea, vomiting, dizziness, light sensitivity. All these things are signs and symptoms of a concussion. And one thing I like to tell folks about, the brain is like a muscle, right? And when we think about recovery from a concussion, there's a fine medium of working that muscle but not overworking it. So back in the day, the recommendation was, if you get a concussion, just go home, don't do anything, be under dark lights for weeks until it resolves, right? And we've learned that that's actually not the right approach, right? The other spectrum of that is when people say get back on the horse and go right back to it, right? So it's somewhere in the middle where you work your brain enough to keep that muscle going, but you don't work it too much to fatigue. And the reason that's important is there's a small window to be able to catch folks with concussion and treat them appropriately. And if you miss that small window, whether it's 2 weeks, 4 weeks, it's harder to get them off of that train of symptoms, right? So it's important to present early, even if it seems minor to you, so that we can have a clear regimen to get you back to life as quickly as possible.
With us is Dr. Enyinna Nwachuku, and again, Director of Neurotrauma at Cleveland Clinic Akron General. Doctor, let me ask you this. When we talk about trauma injuries to the head, the
Yeah,
basic question that a lot of us will think about a big, gigantic blow to the head, and then you got a concussion or something worse.
sure.
Is there the possibility of the same sort of brain trauma, head trauma with constant hitting? Maybe not the gigantic blow, but for
Sure.
example, a football player that might be in the line and constantly bang, 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 bang. Do those also add up to being really significant brain trauma injuries?
Yeah, no, that's definitely a good question, Ray. So we found that, as you would intuitively think, the more repeated injury you have to the brain, the larger the consequences, and your ability to recover becomes smaller each time. So your first concussion, you may be able to push through it, recover, but each time you have a subsequent hit to the brain, your ability to come back from it back to baseline becomes that much more arduous. So yes, there is a cumulative effect that we see in mild TBI and or concussion. And the sad part is that, unlike a very severe traumatic brain injury, like you would see in a motor vehicle accident or a motorcycle accident, these quote unquote mild concussion, mild TBI or concussions can be very debilitating. People aren't returning back to work. They can't concentrate. They have relationship issues. So looking at them from outside, everything seems perfect. There's no visual scars, but they really have a hard time, especially if you don't get them into a right regimen to get them out of that kind of loop of symptoms that they have.
For the average parent, and let's say the parent or the child is playing a baseball game, like you said, gets hit with a ball, or your soccer player or a cheerleader falls off a stand and hits their head. I often heard from other parents tell me, "Don't let the kid go to sleep. Keep them head up."
Sure.
All
Yeah.
those type of things. Does
Yeah.
that make sense when we're talking to the parents out there listening to our conversation?
Yeah, it kind of touches on what I mentioned earlier about the old dogma of traumatic brain or concussion management. I think the first thing is that if you suspect someone has had a concussion, to make sure that they present to medical attention and have a medical professional actually evaluate them and determine whether their symptoms are actually a result of concussions, etc. I think it's a journey and a battle that parents and or their loved ones don't have to go alone. And like I said earlier, I think it's important to present to medical attention, thus, so we can have a clear outline of how to manage. So you're not at home in the dark or not waking someone up for days because you think that's the right approach to do it. The treatment protocol has changed so much in the last, I would say, 15 to 20 years. So things that we knew before we did before aren't necessarily current guidelines and recommendations.
Yeah, and let's get into that now. We're with Dr. Enyinna Nwachuku, I should say,
Yep.
Director of Neurotrauma at Cleveland Clinic Akron General, because now at Cleveland Clinic Akron General, they're a level 1 trauma center, which means
Exactly.
they're going to be getting able to diagnose and really dissect these injuries. But I'm not the doctor. Let's Aina take it from there and talk about what this means with it now being a level 1 trauma center.
Yeah. And so Ray, did all my training in Pittsburgh, and I have a subspecialty training, as you mentioned earlier, in neurotrauma. That's both spine injury and brain injury. And one of the reasons that I was brought here after training was to help develop a actual protocolized neurotrauma program. And what that entails is a multidisciplinary approach. So we see, again, this whole severity of traumatic brain injury. So people who are in a coma after a motor vehicle accident, large head bleeds, long recovery process. And it's important to not just be a level 1 trauma center, which we are at Cleveland Clinic Akron General, but to actually have a protocolized um, uh, program that allows us to be able to deliver precise, individualized care for these patients. And it starts with how do we triage them when they get to the ED, how the actual general trauma folks actually treat and manage these patients before even the neurosurgeon gets involved, and how we manage them while they're in the hospital. So we have a dedicated neuro ICU who focuses on patients just like that, who treat patients with neurotrauma and are up to date on the most current protocols that we utilize for treatment of these patients. And one of the unique things that I think actually exists within our enterprise is our post-surgical, post-hospital care. So we have a multidisciplinary TBI clinic, which again manages patients from the severity of concussion all the way to severe traumatic brain injury. And it starts with myself as a neurosurgeon, and then I collaborate with individuals in physical and medicine rehab doctors, and also individuals with neuropsychology to kind of treat the whole disease process, right? And we have an office over in Bath at the Health and Wellness Center that we help treat patients with traumatic brain injury after they've left the acute setting and now are in the outpatient setting and trying to reintegrate back into their community or their society.
When we talk about a level 1 trauma center, there's a lot of variables, folks, that goes into this. But
Yeah,
when you're treating these injuries, Aina, I guess talk about time is the essence, I imagine, when we
yeah,
talk about most of these trauma injuries and with the
yeah,
technology you now have at
sure.
Cleveland Clinic Akron General, talk about that aspect of treating these type of injuries.
Yeah, no, I think Ray, you hit the nail on the head. We speak about this often in I would say the cousin disease, such as stroke, time is brain. I think that is also evident in traumatic brain injury. So the efficiency in which we triage these patients. So once they hit our door, how quickly we get them to the OR and or to our neuro ICU is key to actually provide an individualized care plan for them. I think what you said earlier, one of the things that has truly revolutionized the treatment of traumatic brain injury is a concept called multimodal monitoring. And essentially, it's a fancy word to say that when a patient is treated by us with a complex traumatic brain injury, we put small fiber optic probes and drains in their head that allows us to be able to understand real time physiology that helps us guide our care. So the old protocol before was you have a head injury, there's this cookie cutter approach that we have. Everyone gets this surgery, everyone just stays in the neuro ICU, and we kind of keep our fingers crossed that they get better. Now, with precision, I can actually say patient A, this is what's going on in their brain after this injury, and this is how I'm going to treat them, versus patient B, who has this other subset of traumatic brain injury, and this is how I'm going to treat he or she. And that's just because I have the technology. The technology has allowed me to deliver what I call precise, individualized neurotrauma care.
That's fabulous. With us is Dr. Enyinna Nwachuku, again, Director of Neurotrauma at Cleveland Clinic Akron General. You mentioned it briefly, but expand a little bit because we're talking about getting this technology and this care out into the community. You also have a clinic in Bath set up for trauma injuries. Touch about what is available there.
Yeah. So the clinics that we have over in Bath, as I mentioned earlier briefly, is really dedicated on once I treat you in the acute setting in the hospital with all the technology that we have to deliver more precise, individualized care. The biggest thing, the dilemma we still struggle with is how do I integrate you back into society? How do I integrate you back into your community? And when we do that, it has to be a team approach. I don't have all the answers, right? And it's a very complex disease process. So I need other professionals who have the wherewithal to be able to help me take care of them. So over at Bath, like I said, as I mentioned, we have, obviously physical rehab. We have a physical medicine and rehabilitation physician who is trained in traumatic brain injury and the sequelae of that, and a dedicated neuropsychologist who treats the cognitive and neurobehavioral side effects that people have after a brain injury. So again, our goal in this multidisciplinary approach is to be able to get individuals back into their community and functioning back in their community and to lessen the burden that they feel and also their own caregivers, family members.
It's fabulous that this treatment, this technology, with us right here in the Akron area with Cleveland Clinic Akron General, kind enough to join us this month and here on WAKR's Dr. Enyinna Nwachuku, again, Director of Neurotrauma with Cleveland Clinic Akron General, talking about traumatic brain injuries. And you can see the technology is right now in our own backyard. Dr. Nwachuku, thanks for joining us. We appreciate the time, the effort, your technology, and certainly your area of expertise in helping all of us in the greater Akron community.
Well, thank you, Ray. I appreciate the time and the platform to be able to share what we have going on over in Akron General. And I'm happy to expand any other time needed.